Good evening, guys. I'm sorry I couldn't make it on Zoom. I'm really sorry for that. But let's talk about today's strategies of case studies, what it could be, and how we can use a right strategy to get the right answer. Let's get started. So, our objective today is going to be what we should observe in case study, what is important, how to eliminate a wrong answer or a wrong option. Common distractor. This is the main thing that I wanted to share with you, and how we know what is a common distractor and how we can approach a right answer. Remember classic signs of disease. Take a clue and recognize the priority. I'm sorry for the spelling of the classic, but I know you'll get it. So take the clue. Clue from where? Clue from labs, vitals, most important clue from assessment, the findings, and recognize the priority. Learn to take the data correctly because case study is all about you taking the clue and taking the data and write it down. The second thing I want you to do is learn to have a classic science of each disease. Whatever disease you uh, remember or take notes, always take notes. What is the classic sign of this particular disease? Because that will help you to solve the case study. Every disease have their identification. It's like an identification card. So if you do not know their identification card, you might not able to identify the disease. And if you cannot identify the disease, probably you cannot reach the right answers in the case study. So you need to recognize the classic signs, very important, and look for these particular labs, medicine, history, most important, assessment. So, how we can take the data? I will let you know that not everything important equally. Just keep in mind, not everything is important equally. Some pieces are very important, some pieces are very crucial, and some pieces are not. And how we can prioritize that. So, most important thing is assessment. This is the objective data. This is the data that you are observing. This is the data you going to work on first. Take that first. Prioritize that according to ABC. Acute neurological changes, severe infection, rapid deterioration. These are important, and you need to write that down whenever you have a case study in your practice question, because learning how to collect data is the most important thing. Now let's see how to eliminate a wrong answer. How we know that this could be the wrong answer. So these are the list that I made it that can be used as a distractor, which I usually use as a distractor whenever I do practice question. So first is appropriate intervention, but not the priority. So if you set your priority and you see intervention as if you feel like you get stuck with two answers, and just pick the priority, but not only the intervention, but also the priority. Second, mention assessment while implementation needed. So if there is an emergency and you wanted to do assessment, probably this is the wrong answer. Long term teaching when the patient is unstable. If patient is hypothermic, hypotension, hypertension, bradycardia, tachycardia, zero output, you're not going to teach anything, neither to family nor to patient. So probably it's a wrong answer. Treatment for a different disease. If you know your patient have a classic signs of particular disease and you know that disease, you know that every Nclex format, they're gonna use different diseases sign as well to make you distracted, to make you some confused. So please know the classic sign. So that will help you to point out a right direction. Something that can be done later, they will add it in the option. So if you know that what is your priority, you will know that anything that become done later can be done later. It doesn't have to be done right now. So that would be a wrong answer as well. Very vague answer or mention no detail according to case study. So some answer has very vague, superficial answer, has no detail whatsoever, or maybe they have a detail but have a wrong detail. Example, patient came in ER wheezing, retractions, which is not good a sign. Labs, pH is high, PCO2 is pretty low, 25. What is your priority? Even go to answers. Just ask yourself why. Why is your priority? I would suggest you to keep your priority or make your priority before even you read the answers. That will prevent you to be make more confused to yourself. You don't want to be confused? Fix your priority before you read the answers. Fix your priority before you read the options. And you will see if you're learning in the right way, you will see the answers according to your priority. If it may not be exactly what you're thinking, you may be nearby something, nearby whatever you're thinking. Ask yourself, how will I approach this issue or priority? Let's see. Is it priority of bronchodilator or O2? Is it priority of this particular patient with wheezing, with the pH high, with PCO2? What is your priority? To give bronchodilator or AO2? Think about it. Once you think about your answer, you fix your priority. Now read all the options. So it's also the scenario of distractors. First A, give patient O2 2 liter through mask. B, reassess patient airway. Draw a blood for allergies. D, give bronchodilator and provide O2. My right option is D, give bronchodilator and provide O2. And how I use a distractors, this is how I use a distractors. So this in blue, all those I use it as a distractor. I kept in the mind that I should use a distractor, something that has appropriate intervention but not the priority, like draw a blood for allergies or give a patient O2 2 liter through mask. If a patient having retractions, I don't think so 2 liter will any help them. Mention assessment with implementation needed. Reassess patient airway does not give me any good outcomes while patient needs immediately implementation or action. Something that can be done later. Draw a blood, we can do it. We could have done it, but since we haven't done yet, I would not do it on a emergency situation, especially for allergies. I cannot do it. Very vague answer. Mention no detail according to case study. Give patient O2 2 liter through mask is very superficially. It has no detail or depth. While the right answer, the D, it gives me the depth that, we're going to use a bronchodilator and oxygen because those are the priority for respiratory problems.
So, as usual, in every case study, patient have to deteriorate or something happen badly that you immediately need action. Here we are, few hours later. A nurse see new labs. PCO2 has been increased significantly. Patient seems lethargy and fatigued. So you know that it's really expected that in asthma, PCO2 decrease and then increased. This is like really dangerous sign. It means patient is getting tired and the lungs is not really compensating the oxygen and CO2 exchange. So let's see, ask yourself, is that a worse condition? Obviously, in Nclex farm, and they're not gonna give you better conditions. So it is worse. It could be what it could be. How can I fix it? So if it is worse, how can I fix it? Think precisely with the rational. Even if you go to answers, just go with your head set. What rational I need to look for. So this is how would I approach, like, okay, the patient is deteriorating, it's getting worse. It means the bronchodilator that I gave didn't work. Now my priority has changed. What is now my priority? Is it patient hypoventilating or hyperventilating? Does he needs assessment or implementation? Well, the airway is blocked and patient is giving up. I mean the lungs is giving up. My priority should be airway, breathing, because this is ABC I need to work on. No assessment, no medication, no nothing, but something that can open airway immediately because bronchodilator is not working. So my priority is decrease inflammation so airway can be clear. This is the ABC pattern, right?
So before even going to answers, I know my priorities. He needs to breathe better. His airway should be clear. His inflammation, his bronchospasm should be resolved. So let's read the options. Teach patient breathe slowly and deeply to better perfusion. Nebulize patient with the albuterol. Prepare for emergency needle decompression due to suspected uh, tension pneumothorax. Call rapid response. Prepare intubation. Wow. I know what I know, and I know what I want. I want answer D because this is the only answer that resembles or aligns my priority and my goal. All the other three answer does not align with my goal.
C. Setting up your priority. You know what you're looking for, and then read the answer helps you a lot. But also, when you know the common distractors, that helps you a lot not to stuck with the two answers. Because you know you're looking for detailed, you're looking for implementation, you're looking for something that needs to be done in emergency. It cannot be teaching. It cannot be anything about other disease. It cannot be a vague answer. You're looking for detailed answer. So these are the lists that I set up. I set up for a distractor because actually I don't want you to give a right answer. I want you to distract. So I feel good that, oh my goodness, I made a hard question. I made advanced questions. So when you distract, it kind of makes me happy. So these are the lists that I made it. Appropriate intervention, but not the priority. What was that? It was a nebulizer because asthma they use nebulizer, But is that the priority when patient is unstable or going to be unstable? Probably not. Long-term teaching when the patient is unstable. A long-term teaching or any kind of teaching is not a good answer. Maybe it could be good answer according to other situation for better perfusion, but not in this situation while patient is going to be unconscious anytime soon. Treatment for a different disease. It was a C treatment from the different disease while I'm treating my asthma patient. Very vague answer, mention no detail according to case study. So all these three was very vague answer, has no detailed according to my patient situation. Sometimes they add very close detailed, but half is truth and half is lie or wrong. So you need to read all the answers and properly and everything. So, the summary of this video is a classic disease signs. Think like ID. Since I live in Texas, I'll just say think like a Texas ID because if you do not have the ID, you do not have the identification. So people unable to identify you. So it's like identification card. Each disease has their identification card, meaning like they have each disease has their own classic signs. Truly, truly, I'm telling you, study classic science whenever you study diseases because this will help you identify the disease. This will help you to solve your case and also connect that disease with the anatomy of the particular organ. This will help you to prioritize what is the priority according to ABC, right? All my video was like main on common distractor and setting your priority before ahead. So remember, strategies is not the magic to give you right answer. It's just another step to help you out towards the right answer. Set your priority, rationalize it before you go to answers. This will protect you not to be confused with the two answers. And I will make this video to be end. Thank you so much to listening and I hope you learn from it. I hope you will implement on these all the distractors and priority and rationalizing towards your practice, towards this journey. And I hope you will pass. Thank you so much.